It's VNN's Brittany Harlow. Thanks for joining us today. We're having a 1-year anniversary recap. Joining me today is Leslie Smith and Marjorie Ray. We spoke with them a year ago about the financial crisis for mental health providers in Oklahoma. And so it has been 1 year, and we're just checking in. If you guys want to give a brief introduction of your experience and your organizations, starting with you.
All right. Leslie Smith. I have a private practice called Be For Me Counseling Recovery. I bill my Medicaid and the services for those clients through the state of Oklahoma. And this last year has been a struggle. We're still not being paid the fees and rates that we were promised. We can see a difference between what we bill to legacy Medicaid that is still being paid by OHCA. But what we're seeing with these three contracted insurance companies, the confusion and chaos is just outrageous, and we're not doing well.
And we are going to be linking to that video that we had done 1 year ago to give people some more background information of exactly what the situation was a year ago. And we'll include a brief summary at the top. But essentially, it is still relating to this sooner care transition to managed care. And Marjorie, if you want to give just a brief intro about your organization and how you guys came to be partnered up.
Excellent. I am Marjorie Ray. My agency is Hope Blooms LLC in Muskogee, Oklahoma. We have Leslie Smith as an associate with me, along with 15 other therapists, 15 case managers, and 15 peer support members. We are struggling financially because the Managed Care of Oklahoma crisis, which began on April 4th of 24, has left us, as well as many other agencies, financially devastated. They are not paying providers the proper amounts. The Managed Care of Oklahoma, which is Oklahoma Aetna, Oklahoma Humana, and Oklahoma Complete Health, have paid at lower percentages than legacy Medicaid, and they promised to pay us the same as state Medicaid. But since that time, they have not. So we struggle to pay the providers. We see our clients. We bill regularly as we should, but the income is not coming the way they were promised.
And I'm surprised to hear that, honestly, that after a year that these issues are still happening, and not necessarily, I know that we had touched before on just kind of billing errors and just the codes not matching up, and there's going to be a little bit of lag time. But even now, a year later, from my understanding, they are supposed to be paying at the Medicaid rates as before, but they're saying either we're not going to pay at those rates, or these certain amounts are in and whoever wants to take it can. But as far as the number of visits allowed, they're supposed to be doing it at 8 a week max, but they're saying they'll only pay out at 1.
Okay, so just a little bit of clarity there. So yesterday, Marjorie received at Hope Blooms a letter from me from Humana, and basically Humana is saying you cannot bill 2 individual sessions, okay,
per week.
Okay, you can't do that. And the state says yes, you can. And then there's modifiers to say whether it's an individual session, a family session, with or without the client. Where the 8 comes in is the state uses a method of measuring time in 15-minute increments.
Mm-hmm.
So if I'm going to do 4 units, that's 1 hour.
Mm-hmm.
Okay. So in the beginning, and up until recently, it hasn't been that long ago, if I submitted 4 units to one of the MCOs, they would only pay 1 unit, which was $19.
For 15 minutes.
For 15.
So basically a segment
Right.
of the full session and not the full session.
And that was a coding issue. Mm-hmm. But this other issue that we're looking at now is we have always been able, because the state asked the individual providers to also provide family support. So it's not just, and especially if it's a minor client, Okay, so we want to come in and do family, and sometimes the client isn't present so that we can find out what the progress has been on a certain objective. If the family still needs some other assistance that maybe we could put case management with and help them with something, some training, that kind of thing, to strengthen skills. And the MCOs are saying, no, we're not going to do that.
When you approach them, an MCO, one more time, what does that stand for?
Managed Care of Oklahoma.
Okay. And so those are one of those three groups.
Right.
Okay. And so when you come back and say, so I understand that you as an organization, as a company, have these set rules, but you're supposed to be following the rules of Oklahoma, like that was the deal. And these are Oklahoma's rules. What kind of response do you get back to that?
This is where I'd like for Marjorie to kind of chime in. She has been on several Zoom calls, I guess.
Yes.
Okay, that are supposed to be a lot of the entities that are involved. Communication is also going to the state saying we're still having this problem. I don't think they've ever been involved, but why don't you just describe what that process is like?
So when I reach out to one of the MCOs regarding billing that they have not paid or paid wrongly, they respond, we will send it up for reconsideration, which they sometimes do, sometimes not. We don't always get a proper response. Or like last week, we Zoomed about the percentages. Leslie pointed out to Oklahoma Complete Health, you're paying every one of our billing statements at 10% less. And they responded, oh, we'll check into it. So basically, we get no action from what we put out. We ask for help. They say, okay. For instance, on the letter I received yesterday from Humana stating family is not accessible if you've done individual, 2 weeks ago, we had that happen, had a discussion with our rep, and she said, well, of course you can bill family and individual. That's what Medicaid pays for. So yes, we'll pay. But a week later, another letter saying, we will not pay that.
What's happening? Like who's
That's a hard
like
part.
Nothing happening is kind of like that is the end of the line as far as you've been able to get.
Sometimes what one of the companies told us was, and I believe it was Oklahoma Complete Health, that their system is bumping in information that has nothing to do with us or our billing, but it
causes denials.
It's triggering that. But then, so here's the frustrating part. So yes, I've got this problem with this agency, this one, but until we discover it, until we find it, then when we present it, then we have to present it to all three. But then they say, show us all the claims that this involves. You know how much time that takes. And so we're going through all of our records, trying to support that. And then what I wish is that we could make one call to OHCA. This is their contractors. This is their systems that they have put into place, that they are, that are providing a service for the state. Why is all the burden
on us
placed on the individual providers, the individual agencies? And a lot of us are not these big, huge, nonprofit agencies. We're small. And
small businesses.
It is very, very much so.
Do you have like a financial impact? Like this is hitting us, this is causing us to lose this much, or this is causing this many people to close, or this many people to not receive care.
Yeah.
If you were to ballpark like the biggest kind of the glaring stats there, I would kind of put you on the spot for that.
You remember whenever you were it was on this last call with Oklahoma Complete Health, and you said, this is what we've billed. This is what you've paid.
Yes.
What is this gap? Do you remember what those numbers look like?
Often less than half. What I see we've billed and what we receive is often less than half.
So ballpark, can you ballpark like an amount, like monthly or annually? And
I believe on that billing, for instance, we may bill $26,000 to one company, and when I look at what's received, it might be $10,000. It's quite a bit less. So we reach out. They say, we see the errors. We will send them up for reconsideration. But our thing is, if you follow the rules, pay them, there will be no reconsideration because we're following the same rules we always have for Medicaid. My concern is overall with the mental health crisis, it is causing therapists like myself and Leslie to take time away from clients to dig in the paperwork. And so that's been the crisis, is that we still have clients who need us, and we're over here trying to figure out how do we make sure this billing goes through so the lights stay on.
So you're not getting the paid for the work that you've been doing,
correct,
and B, having to take away time from providing care to patients,
right? And they are also in crisis because the state is the government, the country, people are in crisis in general. And so mental health is even more important, especially in Muskogee, where we're from. So much is going on. Tulsa also, people are stressed.
I was going to touch on that too, because obviously this is a continued issue as far as financial crisis for mental health for over a year. But also just like what other impacts, even as recent as this year, mental health care in Oklahoma seems like it's getting like one after another hits that are impeding care to people who need it.
I noticed that there was some attention to Tulsa County specifically. I wish I had more information. A lot of times I skim it and go, but I do know that, and I believe it was our Attorney General that had talked with a group of people about the impact that this was having. And so when we begin to see that and we see it trickle down into the communities, but I just don't know what power is there. And the other thing too is, if you think about it, even if there was a legitimate, let's say a lawsuit, class action lawsuit, we're looking at the auditors now that are looking at ODMHSAS. They're looking at a lot of agencies within the government umbrella. And some of those will take years. And so the windfall from that, before we have any answers. This is another complaint that I have, is if I find a problem and I ask one of the MCOs to investigate and complete it, what my desire is that they will go back through everybody's claim with that particular code, sweep the whole system and rectify it, instead of taking my individual claim, the few that I caught that I didn't have time to go back in history
and just blanket fix the problem for everybody.
Fix the problem for everybody.
Is there also, I know that there have been some funding cuts in general to like local health, mental health. And so I don't know, to be honest, if those have been proposed or if those have been actually like implemented, like we are like cutting this additional funding. Are you familiar? And we
the thing that I would speak on is there's a group of nonprofits that are our big, huge mental health providers,
like Tulsa Family and Child Services.
Yeah, it's Family and Children,
Grand Lake,
and then we've got Creoaks, and then the other one was
Grand Lake.
Okay, or Lake
Grand. No, those funding have been cut.
Yeah, well, no, not yet. So
there was maybe like a letter that went out, and it was like, oh, that was premature, like
right.
It wasn't supposed to be sent out, but obviously that letter existed.
Yes.
So is that kind of also adding to like the kind of overall, just like umbrella crisis of mental health.
So I talked to a client that has services at Grand, and they went in to see their psychiatrist. And the morning that they went in, this was probably a week and a half, maybe 2 weeks ago. And the first thing that they were told is, we're not going to do any more what they call DMH services. So the piece of that is there's Medicaid, and then there's Department of Mental Health. Okay, if somebody's not eligible for Medicaid, then they can be eligible for this, especially if there's like substance abuse involved. I don't know what all the qualifiers would be. That's what these big companies that we just talked about, they have both contracts for both of those. So this client was told, we're not doing it. We got word this morning that we are no longer accepting any
Department of Mental Health.
Yeah, any DMH clients. Now, this person also had an Advantage program through Medicare. And so what they did was they switched that, and then they said, but we need a $30 copay.
Oh, goodness.
And this person said, I can't do that.
Mm-hmm.
So just that. But it seemed that the employees weren't even aware until that morning that there had been a cut, that there was going to be this. Now, it was a proactive cut.
Yeah.
In case we don't.
Right.
And
in case.
When was that? Was it May?
The May 6th was supposed to be the last day of funding.
Okay, for those entities as well.
Right. So I don't know.
So now they're saying they're going to restructure.
Right.
But it put everybody in a place. What do you do when you work in fear? What do you do? Employees leave. They try to find other avenues. Some of them, that's all they have done is that type of employee, not contractor work, things like that. It's just chaos, total chaos.
Now, what do you, I mean, what is your next steps? I mean, it's kind of like we're definitely going to be following up and appreciate any additional updates that you can provide us. But like now today, like given this, 1 year anniversary of, bringing attention, like what are you
there's
doing?
One more topic I want to address, which is quite bothersome.
Yes.
Is when they say we will sit up for reconsideration, they also have gone back all the way to April of 24 and recouped funds they've paid, which were paid on a smaller percentage anyway. So if they paid a whole therapy unit in 24, they're now going back and saying, for instance, we paid for 2. We paid family and individual. We're taking 1 back. So they're going in the past. So I will get an invoice. I may wake up with a negative 5,020 from one of the MCOs saying, oh, we took this back. So not only are we fighting forward.
When did that start?
We're fighting backwards.
We've been seeing it the last couple of months for sure.
Probably. Not as far back as January, but I would say February, March. They started digging into April, May, June, going through all of our billing that they've paid and saying, oh, we overpaid. I will get a letter from one of them, a paper letter saying, this therapist billed these units. We need you to send back $290.
Did they say why they were paying it correctly before and why, like, what changed? What made them start to suddenly say, we're not going to follow that anymore. We're just going to pay it what we want to pay?
We'll never know.
We don't know.
We don't know because there's no transparency. There's no communication. We have not heard the state of Oklahoma one time say, man, it's tough out there. These people are struggling. Instead, they go, what a success. And yet we've got money missing. And
they're covering.
But to piggyback on that too, this is what's very frustrating. When they recoup money, they don't just recoup it from me or these providers. They shut down all the claims that we're sending through, take that recoupment off of people that were not even involved. So now we have a whole group of people that are not getting paid. So people
outside your organization?
Well, even within. Let's say this person has only been doing 1, which we know it could be 2, but 1. And so they're not even involved in this discussion.
Oh, wow.
But if they've been billing and we've been submitting, then they're saying, no, they don't get paid, they don't get paid. Nobody gets paid until that recoupment comes down to 0.
And we have no control over the recoupment or an understanding of why they're taking the money back that they didn't pay the full amounts on anyway. It's just keeping us like this.
So when we get a recoupment, we get a code or a letter or something that represents the meaning of why it was rejected. It's never detailed. It's a very generalized idea. So now we've got to get back on the phone again and find out what happened. And then we have to tell them, present to them. We can't just say, go back to this particular, invoice or evidence of payment. They want to say, we want to know the client's name. We want to know, the services that were paid, the date that they were paid, when they were billed, who was the MPI provider.
We're doing their work. We're doing their work, and it's miserable. It's unfair, and the people who are doing the work are not being paid fully.
My final question for you guys, who can fix it? Who should fix it? Like if you're like, listen, I
Yep.
know who needs to fix this, and it's you. Like who is that person who needs to be watching this video and understanding what you're going through, and start making their own phone calls and doing their own research and their own work.
It starts with the ones that contracted these agencies. It's like I said earlier. I did not contract these agencies. I contract with OHCA. Okay, that's where my contract is. They contracted with them. They need to find out what are the problems, where are we seeing these problems, and until that happens, until there's some acknowledgement. But it's basically like the best kept secret in Oklahoma. We can't even get the news media. Okay, we are so thankful for the time that you've spent to help us with this.
Absolutely, to get our story out so that.
But the public news media, they don't want to hear it. They go back to the state. The state says, "Oh, we're doing great," and they go, "Well, the state says that they're doing great," and so it just kind of ends there. So we're just landlocked. We're not getting any help.
Well, I appreciate your time today and talking about this issue. I hate that we're sitting here a year
another
later,
year,
and the issues have not only gotten better, they've gotten worse.
They've gotten worse. They're out of control.